back to clinical. So in your clinical documents folder, you will now see a clinical preparation guide. Make sure you print that out and have that with you. It will have your clinical instructor's information. Starts off with telling you, first day of clinical, you will pick your patient at clinical that day, okay? Week 2, you will then go pick your patient the night before.
Wait.
So first Friday, first weekend, that's this weekend, you will pick your patient on your first day of clinical. Read that carefully. That Saturday, you will be picking your patient with your clinical instructor. Week 2, you will go pick your patient the night before. The night before. Not at 8 a.m., not at 10 a.m., not at 12 a.m. 3 p.m. and later. You are not, let me stress, you are not to be in the facility before 3 p.m. That is the agreement we have made with the facilities. There may be other students there. If you're coming up there, going in there when there are other students there, then you are now overwhelming the staff. You must be there after 3 and later. You can schedule yourself however. You can be there at midnight if you need to be, at 1 o'clock, as long as your paperwork is ready at the beginning of your clinical shift. Are we clear on that? I will be checking Trajexis, looking at clock-in times. If you're clocking in before 3 p.m., you will get a notification from me and your hours will be denied. I'm not messing with this. You are going to affect our affiliation. I need you to understand how important that is. But I have this and I have that. Sorry, not sorry. You cannot be on that facility at any other time. That is when we are cleared. You may not go Thursday. You may not go Wednesday. You can only be there Friday evening, and then Saturday and Sundays when you're there for clinical. Please understand that our affiliations are precious. Do not have that many. When you think about it, with all the schools going on in the community, there are not that many. So we cannot jeopardize them, okay? I can't move out of my box, somebody's gonna have to scroll for me. Okay, so you should have seen a sample SIM chart documentation in that clinical documents. You should have printed a blank one and brought with you as well. So anywhere that's referred to as SIM chart, that's the document we're talking about. Okay, that is your patient chart. So that's what you will be filling out. So this Saturday, after you've selected your patient with the help of your clinical instructor, then you are expected to have the first pages all the way up, medications as well, all the way up through medications, and since you will have seen your patient that day, you will have your assessment done that day. Did anybody by any chance print out the rubric as well? Yes. Okay. The rubric tells you what categories have to be done by the first shift. Okay? Of course, this weekend, it's a little off because you're not picking your patient ahead of time. So by Sunday, after having seen your patients, gotten into the chart, taken care of them, on Sunday for this week, you will have your up to page, let me borrow this one, up to page 12 completed. Because you will have gotten all the demographics on page 1. You've gotten your labs, which is on page 2 and 3, I believe. Diagnostics, if there are any. We don't expect a whole lot of diagnostics with these patients in long-term care. Okay? Your skilled nursing facility patients or rehab patients may have something, but that is not guaranteed. Okay? We're not expecting a whole lot of it.
Page 12.
I'll look at page 12 for this Sunday. Okay? Then you've got several pages of medications. It looks just like your drug cards. That's why I'm here, to remind you of Pharm. Right? We are revisiting Pharm. So if your patient has certain medications that you've already done drug cards for, half your work is already done. You will simply transcribe that information onto this form, making sure you have met all the criteria. Pretty much your drug cards pretty much had similar. I don't think it was that far off. Okay, so refresher. Yes, ma'am.
So it's just that one line, like for this medication.
That's one medication, correct. All the way across is one medication. So you've got several boxes for one medication. All right, the first box tells you the name, so the next box, one page has what, 3 meds you could be documenting. There are several pages. I think we made like 3 pages available, 1, 2, 3.
Is there like
Four.
maximum on the medications that we have to write down? Like if they're like taking like 20, do we have to write all of them down, or is there like a max?
So, you are going to write all their active medications, the ones that are scheduled. Okay, yes, if they've got 10 to 15, you will be doing 10 to 15 or 20 medications. PRN medications, you are only going to do the ones they have actually been given anytime during that week. Because they can have 10 pages of PRN medications, but they've only been given 2, a stool softener and a sleeping pill. So your PRN medications, you will only have 2. Your scheduled meds, yes, you probably will have quite a bit, okay? All of this documentation, as you can see, you printed it out, must be handwritten, okay? Must be handwritten. We're not accepting typed, not accepting bringing it up on your iPad and writing it on your iPad. It must be this printed out copy and you handwriting it. No exceptions. After medications is the first assessment, and it says day 1 head to toe. And Saturday you'll be seeing your patient, you'll be taking care of it, so you'll be doing your head to toe assessment. The next page after that, which is page 11, they take vitals, probably more than this, but you are to document at least 2. 1 in the morning, 1 midday or afternoon. Not 1 at 9:05 and 1 at 10 o'clock. 1 in the morning, 8, 9, and then the afternoon, 1, 2. Okay? They should be at least 4 hours apart, at the very least. Then you start seeing some lines and it says nurse's notes. You will start documenting your nurse's notes. Okay? Your clinical instructor will give you some more information as to how many entries they are expecting on your nurse's note, but there will be no less than 2 per day. Now, you're actually going to be interacting with your patient more than that. So they may ask you for at least 4 or to put a note for each time you interact and go into their room. They will give you those specifications. Okay? Remembering, nurse's notes is not your opinion. It is objective. What you saw, what you heard, what your patient said, what symptoms you observed, not your opinion. Not that my patients seem to be sleeping. They seem to be in pain, or they seem not to be in pain. You don't know. Patient reports pain, rating it 4 out of 10. Patient resting quietly, eyes closed, respirations unlabored. In my head, I've assumed they're sleeping, but I've documented that they're resting quietly, undisturbed. Because then, when the doctor comes in and says, "Oh, how are you doing?" "Oh, I didn't sleep at all." And you're like, "You were sleeping my whole shift." No. You documented their eyes were closed, their respirations unlabored. If they are snoring, snorous respirations. Put that on there. It's objectively what you heard and saw, not your opinion. Okay? Your opinions are what will get you in trouble if your documentation comes up for review or it goes to court. If you document objectively, it's clear and cut what you wrote. But if you start putting your opinions in there, what do you mean by that? What does that imply? We're going down a rabbit hole we don't need to go down. Okay? So those are the pages on Saturday you're going to collect. Sunday you're going to show to your instructor that you've got it done. The medications, I don't expect all of it done Saturday at the clinical site. You'll simply have the name, the dosage, the timing, and the route. The contraindications, side effects, patient teaching, all that you will do later after clinical. Okay? You will have time during your shift to do some documentation, but you should not be sitting for hours on end doing your documentation. You get some information, you go help with patient care. Take a few more minutes while things are a little calm, patients are doing an activity, you can go back and work on your documentation for a few more minutes. Okay? You are there to do patient care, not only to sit there and do paperwork. Okay? Your second week, you will have those pages up to the assessment completed when you arrive on Saturday. Therefore, you won't need to sit and do a lot of documentation from there on. It'll be done later in pre-conference, post-conference. Okay? If your documentation, especially your medications, is not ready and complete for shift, there will be dire consequences. Anybody have any idea or heard what the dire consequences are? Not being able to what?
Enter the site.
You'll be sent home, if that's what I heard. You are not ready for clinical. You are not ready and safe to take care of your patient. So do not show up to clinical unprepared. Yes, ma'am.
What do we submit, like,
Hang on, we haven't gotten that far yet. Let me get to do it too, and then I'll show you what you're submit.
So like for Saturday, do we take it like handed in, or we have to submit something like Friday night or Friday?
Okay, so you are collecting your paper, you're collecting your information, right? We'll give you an example on week 2. You've gone Friday, you've collected your information, you've written it all down on your paperwork. Saturday morning, your clinical instructor will see your hard copy and view it. And then during the shift, we'll give you feedback and write comments on that paperwork of what you need to improve, change verbiage, missing this little bits and pieces, add here, add there, okay? Sunday, you come back, you've chosen to do the improvements on that same copy, not a new copy, and you've done your assessments and your nurse's notes and your vital signs for Sunday. You're so proud of yourself at the end of Sunday's clinical shift, you're like, oh, I've just got a few things to add, I am done. I am happy with this. I am going to scan that full document and upload it into the Dropbox. Does that answer the question?
On Sunday.
It is due Sunday by midnight. Yes, it is due, your SIM chart, your patho, and your care plan are all due Sunday by midnight, every week. Yes?
And that's when we go on Fridays. And this.
Starting this week, it's due on Sunday at midnight.
Okay, yeah, but like the whole package. And
The whole package is due Sunday at midnight. You are not uploading on Friday, you are not uploading on Saturday. You are uploading the completed document with comments on it already into the SIM chart Dropbox. Yeah?
We uploaded with the teacher's correction.
Absolutely. If you are that OCD that you want to submit a clean copy without comments, you're going to drive yourself crazy and redo the whole thing. You must submit both copies. The one with the instructor's comments must be included. Okay? It must be included. So, why stress yourself on doing 2 copies? You don't have to. It is not required. It does not have to look pristine and clear. It should look like a working document. That you've worked on it, your instructor's given you some comments, you've improved it, and now you've submitted the whole thing. Are we clear? Any questions? Yes, ma'am.
so for this week, we will submit the whole thing or just up to page?
Is somebody helpful with that?
You're gonna submit the whole thing. So we will do the second day.
Of course. You're going clinical Saturday and Sunday. Yes, ma'am.
So if we receive feedback and we go to make a edit, are we allowed to white out?
No whiteout. No whiteout. How do you correct documentation as a nurse? Line, initials, and you write your correction. Whiteout is illegal in nursing.
Yes.
I know you said no iPad, but are we allowed to write it on the iPad and then print it, or?
Nope. Hard copies. Hard copies. Okay? Because your clinical instructor has to see that hard copy. So on whatever day you're picking your patient, you are writing it out on that hard copy. Okay? That's the last 2 pages of the prep pack. Well, actually, that went too far. Can we scroll back a little bit to page 2? Right there. Perfect. Okay. Page 1 talks about your SIM chart. Page 2 has about page 1 also started about your clinical checklist. Who's printed out that full clinical checklist? It should be, I don't know, how many pages is it? Like 7 pages or so? Okay. It is a very detailed clinical checklist. You are expected to have it 100% complete at the second half of Foundations Clinical. Okay? Foundation Clinical is running 12 weeks, but yes, we still have that break of 6 weeks due to the SU going down and starting back up. The second half will be 1265. Okay? Make note of that when you are clocking in and clocking out for clinicals. You are starting in clinical, what's the number for this clinical? 1260. On week 7 will be 1265. Okay? So making sure you're making a mental note of that.
So
This clinical checklist, you are to start it. It is to show progress that you have worked on it during this term. You have due dates where you are going to upload it, submit it all of it. But it's not expected to be complete. It is expected to show that you have worked on it and have some signatures in there. In 1265, you will resubmit it again, 100% complete. Yes? You are not to cross things out and put NA. You are not to say didn't happen. They don't do that there. Okay? It is not to be blank. Every single item must be addressed. Whether it is you did it and the nurse or CNA signed off on it, or it was discussed at clinical because it was not something that they practiced or had available for you to see and do at the clinical site. So your clinical instructors will then discuss it with you and then they will sign off. Or you have that option of writing a 350 word entry, which is describing what is that and what is the nurse's role regarding that item. Okay, yes, I haven't had a student take that option yet. It's a lot easier to find your nurse or your clinical instructor and discuss the nurse's role on that topic and have it signed off. Okay? This is part of your competencies. Incomplete can result in you not completing successfully your clinical rotation. So make sure that every single box is checked, dated, and signed off. Okay? It does not have to have 2 signatures. One, either the nurse or the CNA that you were with, or the clinical instructor. Does not have to be double signed. Okay? Questions on the checklist? Now on to page 2, the performance evaluation. Okay? It's an evaluation form that you should see a copy in there. Did I download a copy? I'm going to go off camera for a second. Clinical standards evaluation tool. This is the easiest grade you can get. You show up on time, you show up prepared, you show up in uniform, do what you're supposed to be doing at clinical, not horse playing, being professional. You've had no write-ups for any reason at all. You walk out of there with 100. Okay? Your performance evaluation is the easiest 100 you can get. So look over it, being on time, and that means even just a minute late. Okay? Dress code, everything is on there. Professionalism. Okay? If you are involved in an incident at the facility, do not sink into a black hole and think your life is over already. Okay? It will always be discussed. You are not already convicted just because you were involved in an incident. Okay? Do not panic. I can't tell you how many times the students have panicked. No, we will always discuss what your role is and what the actions were and what happened and what can be improved. Okay? If it is a detrimental incident that the facility says that you can't return, then that will be another discussion. Okay? But do not think that just because something happened that everything is over already. Go back to the Sorry. Next one is the clinical health assessment. It's a bedside checkoff. You're doing a head-to-toe checkoff at the bedside with your clinical instructor. You will do one for each term. So in 160 you'll have one, in 1265 you'll have one. Make sure you look at that. It is a full detailed head-to-toe assessment. You will do that at the bedside. They will return it to you to do your nurse's notes based on what you did. You give it back. They can tally up the scores. Then it is returned to you completed for you to upload into the Dropbox. All documents are your responsibility to upload into the Dropboxes by the due dates. If you get it done early, put it in the Dropbox. Don't hang on to it and wait till the due date and then you've lost it. But I did it. I have no documentation. It's not documented, what? It's not done, didn't happen. And you will get a 0 for that. Your bedside clinical assessment, I believe, is an exam grade. I have to look at the syllabus supplement, but off the top of my head. Okay, that assessment is an exam grade. Your self-reflection is an exam grade. Your checkoff, I forget what else. Look at your syllabus supplement. Okay, so your documentations are your responsibility. If you know the deadline's coming and your clinical instructor still hasn't finished grading it, get with them before the deadline. You still have my copy. I need it back, please, so I can upload it. Happens, right? They get sidetracked on something and they've got it in their folder and forgot, oh, I need to return it to you. Okay? Patho concept map. Let me see, did I download that one? Patho concept map. Yes, who used to do patho flow sheets? Death by patho flow sheet. You have been given, what is it when the governor? A pardon. Regarding these patho flow sheets. This one's now a very simple concept map. You print this out and you write directly on here. A medical diagnosis of your patient. Don't do Alzheimer's or cognitive ones because they are very nearly impossible to necessarily do a concept map on. The disease process on those kinds of things are too blurred. Okay? So find a medical diagnosis to do this on. Risk factors. All risk factors associated with that diagnosis. All signs and symptoms associated with that diagnosis. And then potential complications. Then going back and circling or color coding or putting a star or an asterisk next to each of these categories that directly relates to your patient. Your patient isn't going to have all the risk factors, but they're going to have one or two. They're not going to have all the signs and symptoms, but they're going to have a handful, right? And the potential complications. Which ones are related to your patient? Which ones do you recognize in your patient? Okay? Why, if you're identifying which ones are your patients, why am I asking for all of them for each category? Why should you have to list all the risk factors rather than just your patients?
Something happen because we can see.
Why do I ask the question whenever and then expect to be able to tell the difference between all of you telling me answers at once? Ooh, somebody over here was saying something. Give me an answer. It's your voice.
That's so we know what we're looking at.
Okay? What you're looking at on your patient, but also so that you can if your patient doesn't exhibit all the risk factors, but your test question and your HESI refers to those risk factors, and you only put the ones reflective of your patient and not all the other ones, how are you going to piece it together? Right? You need to be able to piece it together even though your patient doesn't have all the signs and symptoms. Right? As well as the signs and symptoms. If the list is greater than what your patient exhibits, then you also can identify what the signs and symptoms they could potentially start to exhibit. Especially if treatment's not going correctly, right? If treatment's not effective, then I can expect more of these signs and symptoms to start popping their heads. Yes? Okay? This bottom half, the disease process, this is where you've been saved. If you are used to doing the patho flow sheet method, the tree type of thing, you are more than welcome to do that. I believe you did cover some of that in patho with Ms. Lerma, right? Yes. So if you're used to that and that's good for you, please go forth and do it that way. Okay? If not, then you're writing it narratively. That same information that you would have put in the tree, you would have written it narratively here. Okay? And citing your source, because you didn't make this up. You didn't invent this disease, you didn't invent the disease process. Which resource are you using to get that information? Okay, you can note it on the bottom of this paper, but on the back of the last page of your SIM chart, it says references. Make sure it's in there. In APA format, meaning, APA format means what? What do we remember about APA format regarding references? The first thing that always comes to my mind is that it is in alphabetical order. Right? It's in alphabetical order for one. Okay? The first line is a hanging line, so that one starts at the edge of the border, and then the second line is dented in. And subsequent lines are all dented in.
Can we, like at the, on the back, can we print those, like the sites for?
On that last page,
Yeah,
so
like-
for the
like
one
if
for
it's
this
the
one,
pencil,
put it on the,
on the back?
no, put it right here at the bottom.
Okay.
And then for everything else, right here.
Oh,
Our lesson has
And
to be
Okay.
handwritten as well.
and they have to.
Yes, this whole document is handwritten. This whole document is handwritten, yes ma'am.
The second question, for the pathway, how many, like, how many do we have to do? Is it all?
How many what?
Like pathophysiologists, like just one?
There's nowhere it says-
Whichever.
It doesn't ask you for more than one. One patho flow sheet. Not asking you for 3 or 4. One patho flow sheet on one of their medical diagnoses, medical conditions. Okay? You're adventurous and want to do more for your benefit, you're welcome, but you are required to do one. Okay? Any more questions on the patho? Make sure you look at the grading rubric. Did I download the rubric? The rubrics are available for you in there. Nothing's a surprise. Yes. Care plans. Care plan. Now all of this, your SIM chart, your care plan, your patho flow sheet, ask your clinical instructor for help. During post-conference is the perfect time to ask for help. If you're not sure what kind of diagnosis to do your patho on, ask your clinical instructor, which one would it be better, which one do you recommend? I'm looking and I only see this. What other diagnosis could I possibly do it on? Okay, ask. Care plans, who's died by care plans also? Oh, just me, I'm that old. Care plan. Have we touched base? You haven't touched base on that just yet, right? Because it's barely week 1. All right, these are going to be the fun ones. Care plans. You all have a care plan book. Yes? You all received a care plan book. In here, you also, thank you. You also received a list of the NANDA diagnoses. You are going to be using this list. The ones in your care plan book, you have to be very careful. When you're looking at the diagnoses, on the left-hand side of the little box, it will say NANDA or it will say ICNP, International something care nursing practitioner. If it says that, that is not the that is not a nursing diagnosis for you. Okay? That is more of a medical diagnosis for a practitioner. That's why we have supplied you with the list. Okay? But your book is still good for the outcomes, for the interventions, and for the rationales. You aren't making up the rationales or the interventions. They are already there, evidence-based for you. That's what you're going to use that book for. And the outcomes can help you to try to decipher what kind of outcomes would be appropriate for my patient. Do not select outcomes that are unrealistic. Oh, patient's got immobility problems. They should be up and walking in a week. Come on, you're good. This is an 85-year-old who fractured her hip. She's gonna barely be wiggling her toes, but that's what we want her to do. Wiggle her toes and bend her knee. Okay, realistic. So, your patient in semi-identifiers, age, gender, date, subjective and objective data. Not all data, but those that are related to the nursing diagnosis that you have selected, a high priority one. However, in your skilled nursing facilities, this is the only, in foundations is the only course that you will be able to use risk for diagnoses. Your patients are a lot more stable, so they will have more risk for diagnosis than necessarily active ones. Okay? So if they are risk for fall or risk for injury related to, what would it might it be related to? Risk for injury related to altered mental status? Is that what you said? Altered mental status as evidenced by, and what is my evidence? I will have 3 or 4 evidence. Alerts to self only, right? Unsteady gait. Give me a third one. I can only come up with 2. Okay. Mhm. No, not the nursing diagnosis. The nursing diagnosis is risk for injury related to altered mental status. Something like that. Okay. Altered mental status, elevated ammonia level. Polypharmacy, medication interactions. Okay. My evidence. My goal, I have one goal and several outcomes. The goal is patient remains free of injury. Outcome, the first one, what did I say, was alerts to person only. Outcome will be alerts to person and place. I don't expect them to be alert times 4, right? That would be a miracle. But at least person and place times 2. That's an improvement. What was the other thing I said? I forgot. Oh, unsteady gait. Patient will use assistive device when ambulating. Do you see how it's related? Okay, not complicated. Keep it simple. Do not reach all the way out there. Stay right here. This is where students get tripped up the most. But this isn't, it's like, wait, I have the evidence. How do I want to correct just that one little factor? Okay, one for each. Then your intervention for that factor. What am I going to do to help that person be oriented? Reorient frequently, or each time entering the room, reorient patients to person in place. Okay? Now, these interventions, I'm pulling them out of my hat, but you can find them in your book, in your nursing care plan. Okay? That's the intervention, and with that intervention, there will be a rationale, and you're simply writing that rationale. Okay? These are things that you can, the interventions and the rationales you can find in your book. The outcomes, you can even find some of those also in that nursing care plan. There will be some outcomes in there that will be helpful to you. If you look through that, if you have not cracked the seal on that nursing care plan book, now's the time to do it. Go and look and see what it is that I'm talking about and where things are placed within that. You'll see nursing diagnoses that will be in a kind of like a grayish box, and then underneath that, outcomes and symptoms will be, I think, side by side with it, and then interventions and rationales listed after that. Okay? Questions so far? Time, realistic time for this goal to be met. You're going to be there for 2 days. So is it going to realistically be able to be met in 2 days, or at least improved in 2 days? Right? So my goal is either met, not met, partially met. Okay? In 2 days, yes, I've got that patient being able to tell me their name and where they are. Perfect. Goal met. Goal partially met. Patient still only oriented to self. Okay? So you will start this after you've selected your patient and be completed and uploaded Sunday evening. Questions on care plans? Good. Ask for clinical instructor. You can inundate them with questions. Care plans. All right. Next.
Yes, slow down.
assignment that is the easiest 100 to get. The preceptor assignment sheet. You're putting the date, the time in and out of your shift, your name, of course. The preceptor, the nurse you're following that day. Okay? For the nursing facilities, not all of them are have designated areas, which is fine. That part will be more applicable once you move into the hospital. Okay? One facility has the the respiratory wing. A lot of the patients have trachs. So that's at St. Teresa. All the other facilities just have different hallways, so there's not necessarily a designated area. So then here, either that nurse that you followed signs or your clinical instructor. This form, if the facility has what they call a clinical ladder and the nurse wants to apply for that clinical ladder, they are going to ask for a copy of this. You may give them a copy. That's what this is predominantly for. Okay? So as long as you keep track and upload it, easy 100. And you've got a signature, not both. Both do not need to be signed, one. If the nurse decides, oh no, I don't think so, I'm not signing, then your clinical instructor will sign for you. Okay? Yes, ma'am.
You said if there isn't a designated area, what
Just leave
do
that
we
blank.
have? Leave it blank.
Just leave it blank. For the foundations, I know majority of them are going to be blank, with the exception of St. Teresa's that has the respiratory wing. Okay? Questions on the preceptor assignment sheet? So you have to have this with you. This paperwork you must have with you at every clinical shift. You should have this with you every clinical shift. You must have your clinical checklist with you every clinical shift. A blank or starting to fill out SIM chart, patho flow sheet, care plan. Okay? So if you've got a clipboard, if you've got a little, one of those, I used to have one, kind of like a plastic binder type of thing, also clipboard. That's fine as well, a little accordion. She's got a nice little accordion. Nobody here has, that one's what I was thinking of. That's the big one that I have. There is one that is a clipboard. It's a little metal that folds. Folds in half or trifolds. Do you have that one? No? There it is. Can I borrow? Going off camera, sorry. It is a clipboard. Right? It's a clipboard. But it folds in 3. You need to make a page so that you can advertise it and then you can get money royalties, right? But your papers are clipped to it, nice and secure, and then you can fold it. And if you've got big pockets, it can even sometimes, I've seen the guys fit it in their pocket. But it's nice and small so that you're running down the hallway. Right? And it's still secured in here. And it's got some nice reference information. Nicely decorated. Okay? So you've got options. It is not one thing is required except for being organized. And not losing any of your paperwork. Do not lose it. Okay? Okay, so then the subsequent pages have all the different clinical sites, the clinical instructors, the time of your shift, and a little bit of information regarding parking if it's an issue. Most of the skilled nursing facilities, parking is not an issue. It's a parking lot, park in the parking lot. Just don't take the handicap spot if you don't need it. Okay? Questions so far? Really? I don't trust you.
Hold on.
Yes, ma'am. Okay. So questions around paperwork and clinical rotation shift, you're contacting your clinical instructor. If you're sick, if you're not going to make it to clinicals, you need to contact both your clinical instructor and your course instructor. And you can add me in it if you choose. But you must let those two for sure know. Okay? What the issue is. I'm sick. I was in a car accident. My child is sick and we're on the way to the hospital. X, Y, and Z. If you don't include me, then they will contact me and then I will get next steps to you. Remembering what excuses are excusable. Acceptable, excusable.
Death.
Hmm?
Family is death, okay.
Oh, okay. She just says death like she's gonna drop at the middle of clinicals or something.
I mean,
Yes, it's excused, but I can't help you after that. Okay, death in the family. Yes. Okay. Death in the family, remembering that it's gotta be immediate family. Parents, sibling, grandparents. You can infer the rest of the information after what I just said. My condolences. Okay? Documentation will have to be submitted. If you're out sick, then you're sick enough to have to go to see a provider and get a medical note dated for that day. I'll go in the morning. Nope. You were not well enough to make it to clinicals that day, then you need to go see someone that day and get a note for that day, so that it can excuse that day, and if it has to excuse you for the next day or several days, then it will have those dates on there. Okay? Then you simply email that to myself and your instructor. Your course instructor, your clinical instructor does not need your medical note. Okay? They're not gonna schedule you, we are. Okay? Did that completely answer your question? So yes, and that's why their phone numbers are on here, so that if you're on your way and there is an accident, you're able to quickly text them or call them. Okay? And then you're gonna follow that up with an email, once you are safe somewhere.
Don't send us pictures.
Oh, yes. If you are in an accident, you are injured, all I need is your medical documentation. That is the note from the facility or provider that you are being seen from. I do not want a picture of you strapped to the backboard. I do not want a picture of your arm with the bandage. I do not want a picture of your family member in ICU with tubes coming out of them. I say this because I have received them and it makes me cringe at the thought of it. Okay? With yourself, yeah, okay, you're the one that gave permission. But if it's a family member, you didn't get permission to blast their picture to your instructors and wherever else you put it. You did not get clearance, or what do you call it? A release of information. Okay? So please, none of those kind of pictures. No graphic pictures. I don't need pictures at all. We just need the medical documentation. Okay? Because then if I get a picture, how do I know that's really your grandmother? I mean, you could have walked by somebody's hospital room and took a picture and said, hey, this is grandma.
Oh my God.
Saving this for later.
Just a thought. Right? Because you're not supposed to have any patient identifiers on there either, right? So please, no pictures. All right. Any other questions on this clinical? Yes, ma'am.
It says we can't leave the facility to get food, we can bring our own food, so we get the dinner and lunch break.
You do get a lunch break. No, this is slavery. You're not getting anything. You get bread and water. That's it. Yes, you can bring your lunch. You can even order Uber Eats and meet them at the door to get it. But you cannot leave the facility. You are not taking an hour and a half lunch and going down to Wendy's because you forgot something. Sorry, not sorry. You are our responsibility during those hours, therefore you must stay on the facility. Okay?
How long is the lunch?
30 minutes.
30 minutes?
Just like a regular
No,
shift.
we do not take breakfast.
It is early. You are going at 6 a.m., so make sure you've eaten something on your way in. Because you're not going to get there, do pre-conference, and then say, oh, okay, I'm on breakfast.
We're not clocking out until we leave, right?
Correct. You're going to clock in when you get there, and you're going to clock out at the end. You're not clocking in and out during lunch. Okay? The time frame that you were scheduled to be there is the hours that you were scheduled to be there, and will be reflected on your trajectory.
Is there like a designated time for all of us for lunch, or is it whenever?
That will be up to the clinical sites and what the flow is going on at the clinical unit. No, do not plan and think that you're all going to lunch together. Most of the facilities don't have a room big enough to necessarily seat all of you anyway, so you may be using their little break room, so you will be going on lunch breaks when that nurse is going on lunch break or things are a little bit slow and this is the time for me to catch a lunch. Okay? Any other questions on that?
Will we be leaving like exactly at 4 or like depending on like our shift?
Depending on how it's
A
going.
little later?
Yes. Your clock time is for sure 6 to 4, but if there is a code going on at 3:55, oh, nope, I can't do that, I'm leaving, no. You're gonna stay and help a little bit, so yeah, you won't clock out till you're done, Okay? You're always leaving your patient safe before you leave. Okay? Yes? Any other questions? Yes, sir.
You will take me back to medications with
SimChart medication?
yeah, the med card, is it going to be free on free medications, daily medications before we go in? And
3? How come only 3?
asking if free.
You're going to list all the medications your patient is taking. All their current medications. So if your patient is taking 10 current medications, you're going to be doing all 10. And then if they have PRN medications, which is as needed, only the ones that have actually been administered that week. So you can think that you may be doing, I've seen about 12, 15, 16 medications the students may have been doing during foundations. So not just 3, you're going to be doing all their current active medications at the moment. Yes? Okay? Did you have a question?
Well, there's still, like for the clinical evaluation, it's only one and at the end of the term, or is it one every?
One each. One each term.
Okay.
The clinical evaluation, performance evaluation is one each term.
Okay.
You'll see the drop box, one each term.
So
Okay.
this one's not due till like the end of the 6 weeks.
Correct.
Okay.
Check your calendar for the due dates. Okay? Check your calendar for the due dates.
And for the care plans, it's one or multiple, depending on the patient?
One sim chart, one care plan, and one patho concept map per weekend. Okay? One sim chart, one care plan, and one patho concept map due each Sunday. Yes?
Yes.
All right. If your patient, by some chance that you've taken care of on Saturday, condition changes and is not there on Sunday, what do you think you have to do? Wow. I should make that answer. No. You will simply do your assessment, your second day assessment and nurse's notes and vitals on a new patient. But you will write but you will write a list of their medications that you will be giving that day. You're not going to have to do the full drug card, but you need a list. And you can put it on the back or an additional paper so that you have the name, the dose, the frequency of that medication so that you are aware of what medications you will be doing that day. Can we live with that?
Yes.
Good. Now, yes? Very good question. Yes, you must be identifiable. You must be in scrubs. Okay? You cannot just wander in your jogging suit and say, oh yeah, I'm going to start looking through this patient's chart. I don't think so. You have to be identified that you're a nursing student and that you are someone that needs to know this information. If you don't, you risk, if you get arrested, I'm not claiming you.
What about other scrubs? It has to be.
It needs to be Southwest. You need to be identified as a Southwest University student. I had a question over here.
Just to clarify, when we go on Friday, we clock in, correct?
Yes. Oh, very good. Thank you. When you start next week going to pick your patient on Friday, you will clock in and clock out. I expect that clock in time to be no less than 1 hour. It should not take you 15 minutes. You need to be clocked in for a minimum of 1 hour when selecting your patient because we have calculated all those hours into your clinical. So 1 hour at least. If it takes you 2, it takes you 2. Okay? If they are busy and you have to wait for them to help give you the information, then you need to sit and wait for them to be able to give you the information. Okay? Thank you. Yes? We're clear? Any other questions on this so far? Sure? Positive? My email is filled with questions after this meeting coming after you. I will be back up here. All right, let's take a look. Okay, let's go.